You brought up endo belly. Let's talk about that.
Yeah.
So, maybe not everybody listening knows what endo belly is. So let's start there.
Yeah. I mean, 80% of women with endometriosis are shown to have like dysbiosis or like a gut disruption.
Hmm.
And, it manifests in different ways for individuals. We see a lot of constipation. We also see a lot of, loose bowels, but we also see a lot of distended bellies. And so, you're like, oh, I woke up and I was like, pretty flat and I drank some water or I just had one meal and then boom, I look 5 months pregnant.
Yeah.
And how many times, like when I was in my, infertility years, I was like, people would say, like, are you pregnant? Oh, like you're pregnant. I'm like, no, no. It's just inflammation and it's just this inability to like get down again, no matter how much I exercise and no matter how much Pilates I do,
Hmm.
that did not change it. And so really it is about, kind of like that dysbiosis, a dysregulation of your gut bacteria and its ability to just regulate, the enzymes, all of the digestive processes. And people are like, but I don't even eat bad. I've been eating clean.
Hmm.
And that's the tiring part of it is so many women, they've gotten gluten-free, they've gone dairy-free, they've gotten sugar-free, they've even gotten meat-free, and I did that too. I went vegan because I was like, okay, I got a little bit better. Yeah, I was a picky eater, right? And then I added some vegetables in, like, this is great. And then I changed my food even more. I'm like, this is great. And then I went vegan because I was like, okay, veganism, this is the way. And I did feel great. And I thought that this is it. Like, guys, like I feel great, but it still didn't knock out that endo belly. And it didn't knock out like my infertility. It didn't knock out, all of those underlying symptoms, even though generally I did feel better. And that's what I'm saying is like diets may change your inflammation and get you feeling, but then there's this underlying mechanism that might still be out of balance. And so for me, like, that diet trial and error, I've been there and done that, especially for endo belly, because it just sticks out. And at this point I'd lost some weight, but I didn't lose the endo belly. And so the endo belly is really about rebalancing that gut microbiome, getting to the right fibers for you
Hmm.
so that you can get things like short chain fatty acids and, other things to work within your gut lining and get the gut lining soothed. I always say that that's your terrain. It's not necessarily your diet, but something in the terrain, like your digestive tract, is off.
Yeah.
It's going to be different for you than it is going to be for someone else. So as much as you hear, and that's the challenge with Instagram these days and like TikTok is like, there's almost like now too much information.
Hmm.
And you're like trying to say, okay, say like Post-it notes, and you just keep saving all these Post-it notes. And then you have like 1,000 Post-it notes of like, which one should I try? Because they're all saying I should do AIP for endobelly. I should go vegan for endobelly. I should take probiotics for endobelly, but that flares up my endobelly. Like, so I think endobelly is probably one of the most complex, but if you get down to the simple way to approach it, here's what I would do. I would first, again, I'm going to go back to sleep. Making sure you sleep and take an overnight fast of like 14 hours. Let your gut get a break and do its work. I feel like our bodies are so powerful if we just, sometimes give it a break. And so for me, sleep was one of my biggest things of waiting to regulate that nervous system, because when I was awake, I was on. My brain was like an overthinker. I could like think, a million miles a minute. So being able to get to sleep, allowing my gut to clear, have bowel movements, adding in some of the right fiber, but also electrolytes. I was really depleted and dehydrated.
Yeah.
And I'm like, I'm drinking water and then I'm bloating. So I don't need more water, do I? Yes, I did. I just needed to be hydrated in the right way. So adding in some electrolytes really helped me too.
Hmm. Well, I want to emphasize, you said that endobelly, you mentioned inflammation. So for people to understand, because whenever we're bloated, people think gas. This is not gas. It is full-blown inflammation. Your intestines are actually inflamed, and the endobelly isn't just uncomfortable, it's painful because nerves are getting stimulated as things get stretched. You're not meant to be distended. This is not a normal way to go about life. I dealt with endobelly personally. I actually posted pictures online where I did look like 4 months pregnant. And it was just unbelievable, like how bad the bloating was, and like praise stretchy pants, because if it wasn't for the elastic waistband, like I'm like, I actually went and bought like muumuu kind of dresses, because I was like, if I have this kind of flare, like I just can't have anything on my abdomen. And you brought up the right fibers for you. Something that I incorporated is cold potatoes. So I cook the potatoes, cool them, and then eat those. And this is another thing that became like a full-time job of like, making sure I got enough fiber diversity
Yes.
in. But the resistant starches, they really helped. It took several months for that to go away, but eventually it did. The other thing is that I have a women's probiotic, and it has a particular prebiotic that's compatible with SIBO. And I've had a past history of SIBO. So I was like, I know this will work and I can incorporate this as well. But I think it's so important, like you said, to make sure that you're also looking at your fibers, because the first thing I think a lot of people think is fiber feeds bacteria, bacteria produce gas. I've got gas, like I don't need that.
Yeah.
And in reality, we need to increase diversity in the intestines because the gut bugs will work for you. Sometimes we do need antibiotics, we need antiparasitics, we need antifungals, we need something that's antiseptic like rifaximin. Sometimes we need those things, but your gut unlikely has a pathogenic organism. Like that's more rare to see, something that's like disease causing, as much as it has commensal flora that are imbalanced. And commensal flora, for any woman who's had a yeast infection, you're familiar with that. You have yeast in your vagina. Given the opportunity, that commensal flora is going to overgrow. So how do we keep it in check? Well, Lactobacillus acidophilus is like one of the primary species that helps keep it in check. Within your gut, if you eat diversity of fiber, you have diversity of organisms, they can also help keep that in check. But it is really painful. And sometimes women, I mean, I've seen women who are like, I only want to water fast. When I have a flare like this, like, what do you recommend in terms of like soothing foods if you're in an endo belly kind of flare situation?
Yeah, it's a great question. I mean, there are some women who just like, they're like, yeah, they want to avoid food. I have so many that just don't eat all day because it's going to create a flare. It's going to create this, distended belly. They don't want to go to work with this distended belly. They'll drink some coffee, get through the day, and maybe eat a meal at night. And that's not, the route to healing the gut. We love to add in like things like aloe vera. Right. I like to add in L-glutamine, but we have to be careful if there is SIBO because that can sometimes, glutamine and magnesium are great, but with SIBO, you have to, dose that really correctly. But aloe vera, the inner leaf of it is always super soothing. Bone broth, we love that. And, having those teas of turmeric and ginger with some black pepper in it. Those are some of the three things that I would say, over a month or two, you are going to see the soothing effects of it. But then you have to look at, how do I not avoid skipping meals? Because that is not the solution. And that actually probably isn't the problem either. When you eat, it's not like, it may feel like that is the problem, but that's not the problem. The problem really is, like you said, that imbalance of bacteria. And we know that there is, this lots of studies that there's like, a meta-analysis done on studies with the gut microbiome with women with endometriosis. It is imbalanced. So working slowly to rebalance that, because it doesn't happen overnight. You can't just take a probiotic and expect like in a couple of days, everything's going to be great. Absolutely. You can add in supplementing.
It would be so great, everyone, but it's not that way.
Like probiotics, prebiotics. I love, like you can supplement that. You can add in resistant starches. There are, also resistant starches supplements. If you feel like the food is not there are resistant starches. There's I think RS fiber from Designs for Health makes one. I think there's sun fiber. These things add in the support for short chain fatty acids, so that will help our gut over time. But again, patience. And this is the difficult part, is finding a couple of these supplements, trying some of these foods that we've talked about through this episode here, and putting them in play with consistency and giving your body some patience. And it's so hard. And I feel almost like, bad asking for women, because they've had patience. They've tried a lot, and they've suffered a lot. And, like they're doing this on the side of their desk, on the side of their families. But if you can give yourself some consistent, support through 2 to 3 months, you will see that your terrain does respond.
If you enjoyed this conversation, then I definitely want you to check out this.